Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the Vitelline veins and its derivatives. Vitelline veins are also called omphallomesenteric vein. The right and left vitelline veins carry blood from the yolk sac to the sinus venosus. We can call they carry blood from the umbilical vesicle to the primitive heart area. There is the sinus venosus. Sinus venosus also receives the umbilical vein as well as the common cardinal vein. The vitelline veins make plexus around the duodenum and passes through the septum transversum. So it make plexus. Actually, they make plexus. We have three major plexuses: the superior, middle, and inferior plexus, the connection between the left and right vitelline veins. One is dorsal, upper and lower one are ventral. Anastomosis between the vitelline veins, left and right vitelline veins, around the duodenum. The liver cords also grow in the septum transversum. Septum transversum is a mesodermal block, embryonic mesodermal block between the developing heart and the peritoneal cavity. The liver cords also grow in the septum transversum and break down the vitelline vein into hepatic sinusoids. They break down the vitelline veins into hepatic sinusoids. The left horn of the sinus venosus. Sinus venosus is a part of the primitive heart. It also receives the umbilical vein and common cardinal vein. The left horn of the sinus venosus is decreased in size. The blood in the left side of the liver is diverted towards the right side. And the right vitelline vein increases in size. We call it the right hepatocardiac channel. If we look at the image here in the picture, this is the embryo. This is the yolk sac. You can also call it umbilical vesicle. This is the sinus venosus area receiving common cardinal vein as well as the umbilical vein as well as the vitelline vein, also called omphallomesenteric vein. So here is the sinus venosus. This is the primitive heart including this part, and it is receiving three major veins: common cardinal vein, here the right umbilical vein, left umbilical vein, right vitelline vein, the left vitelline vein, and this is the duodenum. Around the duodenum we have anastomosis between the left vitelline vein, right vitelline vein. We have the superior ventral anastomosis, middle dorsal anastomosis, lower ventral anastomosis. And also duodenum also changes its shape, it also rotates. And what happened? The proximal part of left vitelline vein disappear, and the dorsal anastomosis between the vitelline vein, they will form the portal vein with that of the right vitelline vein. Left vitelline vein, a part here, a part there, disappears eventually. So this is the future portal vein. This part is the portal vein from the middle anastomotic channel between the left and right vital vein, and most of the right vital vein forms the portal vein. Okay, so we got that. Here is the ductus venosus. Okay, we got that. This is the left umbilical vein. Blood is going directly the left umbilical vein towards the inferior vena cava via the ductus venosus. Okay, so we discussed that we have here the septum transversum. Okay, and the liver bud is sprouting here. Liver bud develops in the septum transversum, and this break down the vital vein into the hepatic sinusoids. This is the hepatic sinusoids as well as the hepatic vein. Okay, and the upper part of the right vitelline vein area here. Okay, right vitelline vein, that will contribute in the formation of the upper part of the inferior vena cava. Okay, so that is coming from the right hepatocardiac channel. Okay, we'll get the inferior vena cava, the right hepatocardiac channel. Okay, so we'll get from this part the inferior vena cava like this. Okay, we got that. Then the right hepatocardiac channel forms the upper part of the inferior vena cava. Most of the left vitelline vein disappears. The dorsal anastomotic channel between the left and right vitelline vein passing behind the duodenum and part of the right vitelline vein together forms the portal vein. So what are the contribution of portal vein? From where they come? They are coming from the vitelline vein, mostly right vitelline vein, and the dorsal anastomotic channel between the left and right vitelline vein. So these together, the anastomotic channel between the left and right vitelline vein and the right vitelline vein together forms the portal vein. The superior mesenteric vein is derived from the right vitelline vein. Okay, now we find out the derivatives of the vitelline vein, upper part of the inferior vena cava, hepatic vein, hepatic sinusoid we have just discussed, the developing liver in the septum transversum break down the vitelline vein and forms the hepatic sinusoid and the hepatic vein. Ductus venosus, this is the channel connecting the left branch of the left umbilical vein to the inferior vena cava. Okay, ductus venosus is also a derivative of the vitelline vein. Portal vein, we just discussed. Portal vein is a derivative from the dorsal anastomotic channel between the left and right vitelline vein, and the most part of the right vitelline vein together forms the portal vein. We have superior mesenteric vein, derivative of vital vein. We have the splenic vein, derivative of the vitelline vein. Also some book add inferior mesenteric vein, that is also a derivative of the vitelline vein. Okay, these are my references. Okay, we got that. Okay, so that's all about the embryology of the vitelline vein, formation of the portal vein, the anastomotic channel between the left and right vitelline vein, the contribution of the vital vein to the formation of the inferior vena cava, the upper part, formation of hepatic sinusoids, hepatic vein due to breakdown of the vitelline vein by the developing liver in the septum transversum. Okay, and that's all about the embryology of the vitelline vein. If you have any question, please feel free to ask me. Please share the information with your friends. Please subscribe my channel. Please support me. Have a nice, wonderful and blessed day. Bye now.